everyone, and welcome to the next segment in our Business of Medicine e-learning series. My name is Susie Laux, and I'm the Communications Coordinator here at Harris County Medical Society. In this video, we're going to be discussing things to consider when running your practice and whether you're wanting to open your practice or join a practice as a partner. With me today, we have Dr. Glenn Orsak, Pod Chairman of the Space Center Physicians, Dr. Stacy Jones, MD, Pod Key Physician with Central Houston, and Alex Hills, Director, Direct Hire and Medical Societies with Favorite Staffing. Thank you all for joining us today. Dr. Orsak, let's start things off. If you can please provide us with some insights on what physicians should consider when running their practices' internal day-to-day operations. So why don't you take it from there?
Well, there's four areas I like to approach here on running your practice. There's internal operations, staff scheduling, office workflows, and complaints. How do you handle everything? It starts off with the right system picking for your pick for your EMR and your practice scheduling and your practice administration. We use a system that does a very good job of tracking everything. As far as internal operations go, my office manager handles most day-to-day operations, so I don't have to deal with it. I can focus on patient care. We do have daily huddles and monthly staff meetings so we can communicate changes to the office and any processes that we may improve on. Staff scheduling, again, the office manager handles our full-time, part-time, our contractors. We do have some contractors come in occasionally and help with seasonal flows and special projects that we may be doing. Office workflows, we definitely have job descriptions, and everyone has a specific job duty. We divide our office to front and back and lab. And of course, everyone is cross-trained in case someone's absent or something. We make sure that they can perform those duties. And we do have backup people we can call if, let's say we have a catastrophe like COVID a few years ago, and we had hardly anyone showing up, and we were able to still survive with that. Complaints, those are always hard to deal with, but we do have an active mechanism with surveys and the patient portal system that our patients can actually email me directly and, report things. And we actually solicit active feedback from our patients using a text messaging system.
That's a great idea. Anybody else on the panel? Would you like to? How about you, Dr. Jones?
I would just add one thing on the complaints. That's really important now. A lot of Medicare or Advantage companies are looking into any dissatisfaction or satisfaction surveys from patients. So one thing we did add is a complaint or survey box in the waiting area. So they're able to jot down and put that down, and my manager checks that at least once a week. So yeah, that's become a big part of running your practice too, is how well are your patients satisfied with the healthcare you're delivering and with your staff? Very important.
In my office, we have an electronic medical record system, and we have standard operating procedures for almost everything we do in our office. It's taken us years and a lot of experience and a lot of help from other people to develop these things. I mean, we had to develop personnel manuals, policies and procedures. Contingency planning and HIPAA compliance were some of the things that we had to consider when we first started the practice. Now, one of the things that we actually did in my practice when I first started off, and I have to thank my brother for helping me with this because he's a business manager, he suggested I get a PEO, professional employer organization, to help me manage everything. And it turned out to be one of the better pieces of advice my brother has given me. And we have used a PEO ever since, and they helped me to develop all these things, and they were specifically for medical. So they knew exactly what I needed. They knew how to complete every single form I needed to do, my MDMA, safety sheets, everything that I needed to do. The other thing that we use in our office that helps maximize our patient experience is the scheduling system that we have in our EMR. Again, I can't express how important choosing the correct EMR is in your office is going to be. Our patients can schedule their appointments one of three ways: phone, through the portal, or through a text messaging service. Wait time is actually not that bad at our office, and there's a reason for that. We have a very strict policy on no-shows. We have a 10-minute policy. If you're past your appointment 10 minutes, you have to reschedule, no questions. and we enforce it. Managing patient grievance, that's always a tough one. We get complaints not too often. We have a pretty good rating right now with patient satisfaction surveys. We do address every complaint that we have.
That sounds great. How do you manage your day-to-day non-payroll expenses like medical supplies, malpractice insurance? How do you handle that? And we'll start with Dr. Orsak on that one.
I handle a lot of the day-to-day expenses myself. I have an office manager and she runs everything, but I pay all the bills. But we have a medical supplier that we have, contracts with that will supply us with all our medical goods, and our office manager realize, we need more speculums or we need more sheets or whatever, and she'll put an order in. We get it the next day. As far as malpractice insurance, that's pretty easy. You just find a carrier. I talked to friends there's 4 or 5 different carriers that handle physicians, and you just get a quote and find it.
How about you, Dr. Jones?
Well, a couple of things on malpractice insurance. So I started out with one company that has really been good in the state of Texas. And I've been with them for 20 years. And so they actually reward you each year for staying with them, for not having any claims. So, and you can actually pay into it. So when you retire, you get funds from there too. So I would suggest looking into the plans and making sure that they have some of those benefits once you choose them.
Okay. All right, Alex, can you give us some insights on what physicians need to know about hiring staff and developing culture? Go ahead.
Yes. So when you're looking for staff to, fill your office, one of the best ways is organic referrals. People that you may know, friends of friends, especially for new physicians starting off. Maybe you met someone in your schooling or in your residency that you had a working relationship with, and you think it would be best to try and recruit them to come to your practice. We feel and have seen success in referrals want to perform well because they don't want to disappoint the person that referred them. So it's good to organically find employees if you can. Other resources that you can use, if you're open to new graduates, you can utilize local schools for nursing positions or medical assistant programs. They typically will let you post flyers, or if you can get in contact with their administrators, you can send them the information of your opening, and they don't typically allow you to reach out to the students directly, but if you send them the information, they can broadcast it out or post it on their internal job boards. You can also use commercial job boards and resume search sites that allow you to find all different kinds of employees. So whether it's front office, back office, clinical, non-clinical, you can partner with those job boards. Obviously, there is a fee involved for utilizing their services, but you can work with them on your budget and what you're looking for to see if it's something that's feasible for you. And then lastly, if you would like to use a staffing agency, they can help with finding temporary staff, permanent staff, again, anything from front office to back office. And you can reach out to go over your needs and work together to come up with a plan to help find staff for you. Things that staffing agencies can help you with, they can do the advertisement, they can sift through the resumes, screen candidates, send you the best options, help coordinate interviews, and work with the candidate through the interview and hiring process to take some of that legwork either off of your plate or your office manager's plate, just to give you some time-saving resources in finding candidates and hires for your practice. As it relates to office culture, some things that we see in job seekers and what they're looking for, they really want to feel like when they come to work, they, get along with their employees. There's camaraderie. You do things outside of your typical job duties. For example, employees really like things such as office potlucks or celebrating employee birthdays or work anniversaries, things like that. So they feel like they have a work family, and it's not just coming to work, nose to the ground, doing your job. It's something that we have seen promotes retention, employee retention, and they want to stay if they feel like it's a welcoming environment. Also, benefits offered that contribute to a work-life balance are huge. especially right now, employees are looking for ways to balance their work life and their home life. Some different things that you can do in that regard. It could be, employees getting paid time off on their birthday, or they get an extra personal day or a mental health day that's separate from their vacation. Sometimes people have things going on and they need to tend to appointments and they really don't want to use their vacation if it's not a true vacation. They want to save those hours to be able to get away, take a break, not to go to a mental health appointment or a doctor's appointment. So considering the work-life balance and adding that to your benefits package to really set the tone for your office culture is something that is very valuable to job seekers right now. And then lastly, some staffing issues and how to handle that. What I can speak to is the feedback and information we see in job seekers and experiences that they've had or what they're looking for. One of the biggest things is they want consistency. They want to know that you're following your employee handbook, that you're going by the policies and procedures, that you have set disciplinary actions that you take for certain situations, whether it's starting with a verbal warning, a written warning, a performance or behavior plan, and that you're following those so that they don't feel like there's either favoritism among employees or any certain discriminations where someone might be feeling like they're picked on for a certain reason. As long as you're consistent and you're following the same, policies and procedures with everyone, that's going to, promote more positive employee well-being. So that's what I can speak to as far as the information we see from job seekers on those types of issues.
Let's go ahead and go to the panel and ask a few questions for the physicians. When you first developed your business plan, did you have a staffing plan? And if you did, how did you determine staffing levels, operations versus clinical?
I had a front office person and I had a medical assistant. I didn't start with a nurse. I just started kind of low and slow. The other thing that was really helpful for me that allowed me to kind of do the trial and error was that I did a hospital guarantee income backing, which allowed me to kind of take my time and build up and learn the different positions while my income was still backed or guaranteed. So I did start off with two people. What I've learned to do is develop relationships with the universities that have nurse practitioner schools where they can come out and train, and I serve as a preceptor. So I think that's a great opportunity to get to know nurse practitioners, and I've hired at least 2 or 3 from the programs that really worked well with my office. The other thing that I developed was a relationship with the schools that actually, and I don't know, vocational training schools. I just have 3 or 4 of them that I use, but a lot of them have staff in their facilities that are looking for placement, looking to put their students in for internships and for you to hire. So that's a good way to develop more relationships with students that eventually you may want to hire.
All right, let's talk about the external operations when running your practice.
How do I deal with external contractors or vetting vendors? Vendors are very important. They come a lot of dime a dozen. They come to your office sometimes unsolicited. So I would say, first of all, do not listen while you're busy seeing patients. I set up a time to actually go over vendor contracts or vendor requests, and that's allowed me time to really know what's needed in the practice versus an additional plus or something that is not needed, or just possibly something the patients may or may not benefit from. So I would suggest that you take the time away from your busy practice hours to literally read over what the vendor is discussing and what they're proposing and what they're trying to sell to you. And the other thing that I would say about vendors, they will leave you a contract. I have a medical attorney that I've had now for 20 years, that if I really am interested in it, I send that contract to him. He looks over it. He lets me know positives, negatives, but most importantly, he keeps up with what the law is. and what the law states. That's most important. That's the main thing I would always emphasize on any outside vendor or contractor. Know the law and make sure you don't or have an attorney who will teach you what you can and cannot do in medicine. In terms of contracts, the contracts that come by my desk have been vetted at least by two people. One is the office manager and my medical attorney. And please don't sign anything without the clearance of a medical attorney. Some other external vendors you will need. One is a biohazardous waste company. I started out with one that was really expensive, and I found that I didn't need them to come every other week or every month to pick these needles or any, because I don't do procedures. So if you do procedures, you may need that. There are a lot of biohazardous waste companies out there. Just know that your need. Medical supplies, we kind of touched on that. Again, setting up a relationship. One thing that we didn't mention, I would like to add to that. Once you get into a group where a group of you are buying the same things, you have more power. You can negotiate the prices better. So group up with your other colleagues who are independent. Those kinds of resources are very helpful when it comes to forming alliances and purchasing things. Storage. Storage, when I was trying to switch over from paper records to electronic records, was huge. So I had to purchase a storage unit. You may not need to do that now. Now that I'm electronic and paperless, I'm not storing anything. Anything. My electronic medical records are stored, or my storage for those types of things. Where I practice, I have a pretty big facility. I'm about 3,400 square feet. So I have some storage rooms there for old computers or things like that that need to be actually dispersed of by law. So be careful with just throwing things out. If you don't know, keep it until you find the right contractor or the right facilitator for those projects. Some practice operation needs. And I'm going to give you a scary story. I started out with a kind of mom and pop accountant. He would come in every 3 months and say, sign this. This is what you owe. Mail it off. He would do this in the middle of a busy day for me. I'd sign it, didn't think too much about it. It'd sit there until finally the IRS came. And I was like, uh-oh, was I supposed to do more? I was. So be careful with your accountants because they do good, but ultimately you are responsible. You are it. So I got rid of that person like within the first 5 years of practicing, got out of all of that and formed a business model where I have an accountant that I speak with regularly. He understands, do not come while I'm seeing 50 patients a day to discuss things. We sit down and we have a day where we go over things together, where I can focus and concentrate on what he is saying needs to be done. I have a major company that does my HR, my Texas workforce, and they do payroll, they do the W-2s, the 1099s, all of that. And in terms of my EMR, and my EMR started out free. I knew it would change eventually. So that changed. They started charging per provider a certain amount each month, but it's iCloud, it's cloud-based, and I actually love it. So I don't mind paying for it. My billing partner is outsourced. And then in terms of insurance, you need all kinds of insurance. So you just need to speak with them to know what they cover.
Thank you all for your time. We appreciate it. I'm sure all the medical students who are watching this appreciate it. And thank you for your time once again. Appreciate y'all.